For a further look at the coronavirus curve in Nigeria, we have Dr. Ramsey Yama. He's a senior lecturer, Department of Community Medicine, University of Abuja, also a consultant public health physician, epidemiologist with UATH. Thank you for joining us on the program.
Thank you for having me.
I'd like to ask what your take is on the recent trend of the virus curve, which showed 5 days of a regular decrease in the number of positive cases of COVID-19. What would you say is going on?
Thank you. I will say this is good news to the people and government of Nigeria. It may just herald the beginning of the end of the pandemic, but we should not be in a hurry to celebrate. The evidences are not yet very clear. The end of an epidemic is said to have occurred when there is no new case for a duration equal to twice the maximum incubation period of the disease. In this case of coronavirus, we are talking about 28 days. So we are nowhere close to a situation where we have 28 days at a stretch without a new case of COVID-19 in Nigeria. It also suggests that the control efforts of the government and people of Nigeria is succeeding, even though no one prepared for the pandemic anywhere in the world. And Nigerians did their best to do what they could do in a resource-deficient setting such as ours and a very weak health system. It also means that the interaction between the coronavirus agent, the human host, and our environment may be working in our favor. And as a Nigerian, I will tell you that Nigerians will tell you that the reason why the curve seems to be flattening is because God has answered our prayers. Thank you very much.
So if we look at some of the figures that we know nationwide, in July saw higher numbers than the numbers in June. I think we had over 17,000 cases alone in July compared to June's 15,000. So some might say that perhaps we peaked around the time of July if the first few days in August we're seeing lower cases, and who knows what is to come at the end of August. So in your estimation, when do you think that we're likely going to peak? And what are your thoughts on some of the states like Lagos that say that August will be the likely month that they would peak?
Coronavirus is propagated direct person-to-person pandemic. It is very difficult to predict when it will go down and when it will rise, as we have seen in the case of June and July this year. We had something that looked low, only for it to shoot up again. So it is indeed very difficult to say whether this trend or downward trend will continue. Therefore, Nigerians must not let down their guard. The control efforts must continue, and we hope that the viral agent, the human host, as well as the environmental factors that have been working in our favor in Nigeria and indeed Africa will continue to do so. In the case of Lagos, I will say that it's good news to see that the trend also is reducing in Lagos State, which has been the epicenter of the pandemic. But again, we must not be complacent about the control efforts, as any complacency is going to take us back to where we started. And I'm sure we don't want to see ourselves in that position.
We'd like to thank you. We appreciate your
Thank
time
you.
on the program. Dr. Ramsey Yalma, Senior Lecturer, Department of Community Medicine, University of Abuja. Thank you for joining us on the program.